Hey there, future PMHNPs. Welcome back to another free excerpt from our weekly live sessions at Clarity Education Systems, where we're all about equipping masters and doctoral prepared nurse practitioners like you with tools to ace the PMHNP certification exam. I'm Dr. John Rossi, and every Wednesday night at 7 p.m. Mountain Time, we dive into practice questions, unpack rationales, and host an open forum to tackle any questions you've got, whether it's about your studies, the exam, or just surviving grad school stress. This video, brought to you by PMHNPtesting.com, is all about family therapies, a critical piece of the PMHNP toolkit. From structural and systemic approaches, family therapy helps us address mental health challenges within the context of relationships and dynamics. And you'll need to know these concepts inside out for your exam and your practice. Today, we've got a set of practice questions lined up to test your knowledge and sharpen your clinical reasoning. So grab your notebook, maybe a snack, and let's go ahead and dive into the world of family therapy. So here we go. Let's jump into our first question on family therapies. This is a perfect way to kick off the session focused on understanding family dynamics from your PMHNP certification exam prep. This case challenges us to identify the best therapeutic approach for a family grappling with conflict and enmeshment. All right, so let's go ahead and read the question. It reads, a 45-year-old male with a history of generalized anxiety disorder presents to your outpatient clinic with his wife and 2 teenage children, seeking help for ongoing family conflicts. He describes a pattern of over-involvement with his mother and frequently intervenes in family decisions, leading to tension with his wife and withdrawal from his children. He admits to feeling torn between his family of origin and his nuclear family, stating, I can't say no to my mom, but it's ruining my marriage. As a PMHNP, you consider a family therapy approach that views individual symptoms as reflective of broader family dynamics and emphasizes differentiation to self to reduce enmeshment. Which of the following best identifies the family therapy approach of this scenario? Okay, go ahead and take a second. If you need to pause the video, go ahead and do it, and then we'll jump into the answer here. All right, our correct answer for this one is going to be A, family systems therapy. So in this case, this is a classic example of how family dynamics can amplify individual struggles like anxiety, okay, and create conflict within a household. So let's unpack the patient's presentation, align it with the most fitting family therapy approach, and explore why family system therapy is the go-to here, while running and looking at the other reasons why the options that weren't correct are in fact wrong. Okay, and we'll do all of this with evidence-based reasoning. So the patient here, that 45-year-old man with GAD, presents with his 2 children, his spouse. We have family conflicts, over-involvement with his mother, tension with his wife, withdrawal from his children. He's concerned about his family of origin and his nuclear family and balancing that. And that's what leads to these dynamic struggles. All right, so as PMHNPs, we're trained to see symptoms like anxiety not just as individual issues, but as signals of broader family dysfunction. The question points us towards a therapy that views symptoms as part of a family dynamic and emphasizes differentiation of self. And that is a key phrase right there. Family systems therapy, look for differentiation of self to reduce enmeshment. So these are those key clues to guide your choice. So family systems therapy was developed by Bowen, views the family as an emotional unit where individual behaviors and symptoms reflect this broader systemic pattern, often spanning generations. So central concepts of family systems therapy: differentiation of self. This is the ability to maintain individuality, like personal beliefs and boundaries, while staying emotionally connected to family. Low differentiation leads to enmeshment, where individuals struggle to act independently due to the excessive emotional reliance. Then we have multi-generational transmission. So this is patterns like over involvement of conflict or passed down through generations that start to shape family roles. Another big word to remember is triangles, triangulation. So when tension between two families, like husband and wife, pull in a third party, like the mother, to diffuse stress, often perpetuating dysfunction within the family. So, in this case, the patient's enmeshment with his mother reflects low differentiation, as he can't set boundaries without feeling disloyal. His mother's intervention in family decisions suggests a multi generational pattern, possibly where she relied on him emotionally in the past. So this creates a triangle with his wife, fueling marital tension and distancing him from his children, who withdraw in response. So, why is A correct? Okay, so alignment with symptoms. The patient's anxiety and family conflict are symptoms of systemic dysfunction, specifically his enmeshment with mother. Family systems therapy targets these by exploring multi generational patterns, for example, why the mother over involves, and then fostering differentiation, so helping him set boundaries without guilt. His struggle to say no to mom indicates low differentiation. That's that core issue this therapy addresses by helping him balance individuality with family connection. What is our intervention approach here? So the PMHNP can guide the family to map multi-generational patterns, perhaps using a genogram to visualize roles and relationships across generations. This helps the patient see how his mother's behavior may stem from her own family history, reducing blame and fostering insight. Then we are supporting differentiation, involving coaching the patient to set clear boundaries with his mother. So, for example, limiting her input on family decisions while maintaining emotional connection. So, we want to acknowledge her importance, but keep it at, an appropriate distance. This reduces enmeshment, eases marital tension, and models healthier dynamics for his children. So, therapy may also address the triangle by helping the couple communicate directly and then reducing the mother's role as an intermediary. All right. So, let's go ahead and, let me pop back here. Let's go ahead and talk about why the other options are ruled out. So, with option B, structural family therapy, this was developed by Salvador Muchinchin and focuses on reorganizing family hierarchies and subsystems, things like strengthening the parental unit to correct dysfunctional interaction. While the marital tension and children's withdrawal suggest subsystem issues, the primary problem here is the patient's enmeshment with his mother. This is a multi generational dynamic. Structural therapy might realign the nuclear family, but it doesn't delve into the deeper systemic patterns or differentiation needed to address the mother's role. So, a 1 month follow up, as implied, could be utilized here in some structural approaches, and then we delay addressing the immediate conflict. Okay, option C. So, strategic family therapy, this is associated with Jay Haley and Milton Erickson. This uses directive tasks, things like paradoxical or direct interventions, to disrupt dysfunctional behavior loops. So, while it could address the conflict as a repetitive pattern, the issue stems from this multi generational enmeshment, right? So, not a simple interaction or interactional type of cycle. So, strategic therapy really lacks the depth to explore systemic patterns or to foster differentiation, focusing instead on quick behavioral changes. So, a 2 week follow up that would be utilized here may not allow enough time for the insight needed to shift the deep seated dynamics within the family. And then finally, option D. So, contextual therapy, this was developed, and I'm going to mess up the last name, but we'll go with it. Ivan Basarmeli Naji. And this emphasized the balancing loyalties and fairness across family generations, often through exercises like expressing gratitude. So, while the patient's loyalty to his mother versus his wife is relevant here, gratitude exercises alone don't address the enmeshment or the need for that differentiation. You should have that very much memorized now with family systems therapy. So this approach overlooks systemic, multi-generational nature of conflict. And typically a 3-week reassessment is going to delay critical boundary setting interventions. All right, so this is what we're looking at here for this family systems therapy: enmeshment and anxiety, family systems efficacy, multi-generational patterns, and then your role as the PMHNP to emphasize systemic approaches to address psychiatric symptoms. Okay, so the final answer here, right? The best family therapy approach is family systems therapy. Okay, so that's a great start diving into how family systems therapy untangles complex family dynamics. And that, again, is going to be a must know for you while you're preparing for your exam. So let's go ahead and explore another question. So let's dive into the second question here, where we're exploring culturally rich cases that highlight the intersection of mental health, family dynamics, and cultural values. The question reads: a 35-year-old female with a history of panic disorder presents to your clinic with her husband and elderly parents, who recently immigrated from Vietnam to live with them. The patient reports increased panic attacks since her parents' arrival, stating, "I feel trapped. I have to take care of them, but I can't handle the pressure." The parents expect her to fulfill traditional Vilal duties, while the husband feels caught in the middle, trying to mediate the conflicts. So the family's cultural values emphasize collectivism and familial obligation, complicating the patient's autonomy. As a PMHNP, you consider a family therapy approach that addresses cultural influences, intergenerational dynamics, and the patient's anxiety as a symptom of family stress. Which of the following best identifies the family therapy approach for culturally complex families? Answers are family systems therapy, structural family therapy, strategic, or contextual therapy. Okay, and the answer here again is going to be A, family systems therapy. So this case illustrates how cultural values and family dynamics can amplify psychiatric symptoms like panic disorder. This is a common challenge in practice. Okay, so the patient with panic disorder, is there with the husband, elderly parents from Vietnam, leading to panic attacks. And this is all because of the traditional duties and collectivism. And the husband is caught in the middle there. And that all leads to this panic disorder that's set in. So we recognize that her panic attacks aren't just individual symptoms, but reflections of family stress, shaped by cultural and intergenerational dynamics. The question directs us to a therapy that addresses these factors and also supports, again, differentiation to ease her anxiety towards us, pointing us towards this systemic approach. So, family systems therapy, we've already gone over it. We understand the key points here: that differentiation of self, multi-generational transmission, which is what we're seeing here, along with the differentiation, and then getting our way through those emotional triangles. And here we're seeing triangles form between parents and daughter and the husband. Okay, so the patient's panic attacks are going to signal this systemic stress from her ability to differentiate, asserting her needs while meeting the cultural expectations of her family duties. So this collectivist value reinforces her parents' demands, creating an emotional triangle where the husband's mediation fails to resolve the core conflict, and her anxiety reflects this struggle, exasperated by this intergenerational dynamics that's rooted in her cultural norms. All right, so there you go. That's the reason why this type of question can also be utilized for that family systems therapy. So that's option A is going to be our correct one here, and we're going to explore that cultural collectivism, support the differentiation between mom and parents, and then also overcome the triangle issue when dealing with husband and parents and the spouse. All right, let's talk real quick before we move on to cultural sensitivity. So, this approach respects the family's Vietnamese collectivist values, avoiding alienation by framing differentiation as a way of strengthening family harmony, not rejecting tradition. So, this is going to align with your competency for culturally competent care. Okay. B, structural family therapy. Remember, this focuses on hierarchies and boundaries. So, setting boundaries with the parents could help, but reducing their expectations without addressing the collectivism, that's where we're going to have problems, and that could risk cultural insensitivity. And then we also need to pay attention and don't overlook the intergenerational cultural context here. So for strategic family therapy, remember these are directive tasks. Asking the husband to stop mediating, for example, um, and that would disrupt the dysfunctional pattern. So while it may shift dynamics, it doesn't address again those cultural collectivisms and the intergenerational stress. And then D is wrong, contextual therapy, because remember in this one, it emphasizes balancing loyalties. Okay. Um, so, encouraging the patient to honor her parents' expectations might reinforce her sense of obligation, but that could also worsen her anxiety because she would be prioritizing duty over autonomy. All right. So, this approach, it misses the differentiation focus of family systems therapy. Okay, so great job on that question. I know that's a lot of information for family systems, but hopefully that can help frame it for you so you know what to look for when you get a question about culture, collectivism, and differentiation. All right, so let's go ahead and keep the momentum going. We're going to move on to our next question. And this is going to dive into a case that highlights emotional complexities in intergenerational relationships that is different than multi-generational. Okay. So let's look at this one and explore how family therapy can heal family wounds while also addressing psychiatric symptoms. The question reads: a 60-year-old male with a history of major depressive disorder presents to your clinic with his wife and adult son, seeking help for family tension after the patient's recent depressive episode. So the son reports feeling burdened by his father's emotional needs, stating, "I feel like I owe him for all he's done, but it's exhausting." The wife feels neglected, noting, "I'm always the one holding things together." The patient admits to guilt for burdening his family, but feels entitled to their support due to past sacrifices. As a PMHNP, you consider a family therapy approach that balances relational fairness and addresses intergenerational debts and fosters this mutual accountability to heal family wounds. Which of the following best identifies the family therapy approach for this family? Is it going to be A, family systems therapy, B, structural family, C, strategic family, or D, contextual therapy? All right, so the answer to this one is going to be D, contextual therapy. So, this case is a powerful example of how family relationships can become strained over the weight of emotional obligations, especially when a family member is grappling with a mental health condition like depression. So, as PMHNPs, we need to recognize how these dynamics impact everyone involved and choose a therapy that is going to foster that healing. So let's look at this scenario and align it with why it goes with contextual therapy. Okay, so here we saw a 60-year-old with MDD. The wife and the son are involved here, and we have family tension. So the son feels burdened by these emotional needs. We have intergenerational debt, where past parental sacrifices are creating these expectations of repayment from the son. And then the wife, she feels overly neglected here, and the patient feels guilty, but he also feels entitled. So we see this tension from imbalanced give and take. So we see the patient's MDD as both a contributor to and a reflection of these family dynamics. The question guides us toward a therapy that emphasizes relational fairness, intergenerational debts, and mutual accountability. Those are your key words for contextual therapy, pointing to an approach that heals through ethical and emotional balance. So contextual therapy, this one was developed by Ivan Nagy as well. So we have focuses on ethical dimensions of family relationships, emphasizing relational fairness and the balance of give and take between family members. This is the key concept here. This intergenerational ledger, where family relationships carry a ledger of debts and entitlements, where past parental sacrifices, these are going to create expectations of reciprocity or, you know, give me because I gave to you. Imbalances like the son's burden, this is what leads to tension. So, loyalty and fairness, family members are bound by invisible loyalties, but fairness requires acknowledging each person's contributions and needs. Then we have that mutual accountability here. Healing occurs when families openly discuss imbalances and work toward equitable relationships. And this is going to foster trust and connection. So in this case, the son's burden reflects an unbalanced ledger where the father's past sacrifices are creating this sense of obligation, and it's really just making him exhausted. Where the wife's neglect indicates that she's giving more than she receives, and then the patient's entitlement and guilt stem from the belief that his sacrifices justify his current demands because of his depression. All right. So that's the reason why D is correct. And utilizing contextual therapy is going to facilitate a dialogue of fairness. It allows the family to acknowledge each member's contributions, the patient's sacrifices, the son's caregiving, and the wife's stabilizing role, and the needs that are going to address the core tensions. Family systems therapy. Remember, this type of therapy looks at differentiation and triangulation. Okay, we're looking for we're looking for an ability to apply the patient's guilt or the son's involvement in parallel issues. But the primary issue here is about that relational fairness and the intergenerational debt. And then B, structural family therapy. So structural therapy, remember, this aims to strengthen the subsystems within the family, like the spousal unit, or to improve family functioning. So while we do see the wife's neglect suggest a weakened spousal subsystem, focusing on that doesn't address those intergenerational debt problems that we have in the question. All right, option C, strategic family therapy. So remember, strategic's going to use directive tasks. All right. Um, so this could be an example of asking the son to withdraw support or disrupt dysfunctional patterns. So the risk here is we could escalate tension by ignoring the underlying fairness issue, and that can alienate the patient and then worsen the depression. All right, so this particular approach, it really lacks the relational depth of how to heal the family wounds and move forward. Okay, so final answer here is going to be contextual therapy. Good question. Let's go ahead and dive into our fourth question. So here we're going to be looking at a case that's all about navigating the tricky dynamics of families with a defiant teen. And the question reads, a 16-year-old female with a history of oppositional defiant disorder, or ODD, presents to your clinic with her parents and younger brother. Now, after a recent escalation of the defiant behaviors, including truancy and verbal aggression, the parents report inconsistent discipline, with the mother being overly permissive, and then the father is just totally disengaged, often leading to the patient to take a parental role with the brother. The family dynamic reveals a lack of clear boundaries. You should start, pause here, you should start to be recognizing certain words, right? So, lack of clear boundaries, with the patient frequently undermining parental authority. As a PMHNP, you consider a family therapy approach that focuses on recognizing clear boundaries and hierarchies. Which of the following best identifies the family therapy approach for this scenario? Is it A, family systems therapy, B, structural family therapy, C, strategic family therapy, or D, contextual therapy? All right, correct answer here is going to be structural family therapy. And Here, this this is a classic case of how a family structure or a lack of family structure can fuel behavioral issues like oppositional defiance and making it a prime candidate for targeted family therapy approaches. All right, so the patient, oppositional defiant disorder, parents and the younger brother, there is conflict between the boundaries. Mom and dad aren't giving what's needed, which leads the 16-year-old daughter to jump in as a parental figure, and we're having the blowback here of defiant behaviors, truancy, verbal aggression. Okay, so parental inconsistency. The mother overly passive and permissive, likely avoiding conflict, while the father just totally disengages. That's going to foster this level of unified discipline. Inappropriate roles. The patient is going to take on that parental role with the younger brother, and that steps into a caregiver position because that we just don't have that parental leadership with mom and dad. And then there's those lack of boundaries. The patient undermines parental authority, and that reflects this family structure without clear hierarchies, where all those roles and the rules have just been blurred. So her ODD, characterized by the argumentativeness, the defiance, the hostility towards authority, this is likely exasperated by dysfunctional family structure. Okay, as PMHNPs, we need to recognize that her behaviors are not just individual symptoms, but these are a response to the family's lack of clear boundaries and hierarchies. The question points us towards a therapy that recognizes these elements. So, we have to look at those subsystems. Families are organized into subgroups. We have parental, we have sibling, we have grandparent, and a weak parental subsystem like inconsistent discipline, that's going to disrupt the family functioning. Then those boundaries, clear boundaries, are going to balance closeness with autonomy. With diffuse boundaries, this leads to confusion. So, for example, the patient parenting her brother, while rigid boundaries cause disengagement. Okay, for example, the father's withdrawal. Hierarchy here, parents should hold authority, setting rules and limits. When children assume parental roles, the hierarchy is inverted, and that's what's going to fuel the conflict. So in this family, the parental subsystem is weak due to the mother's permissiveness and the father's disengagement, and that has created a diffuse boundary. And then we have the inverted hierarchy with 16-year-old daughter stepping in for her brother's leadership. Okay, so structural family therapy aims to recognize each one of those particular topics, and that is why B would be the most correct here. So option A, why is it wrong? So family systems therapy, you should be able to all say it with me now, multi-generational patterns and differentiation, okay? Primary issue here is immediate structural dysfunction, and we're looking for hierarchies and boundaries. Option C, strategic family therapy. So here, what do we use? We use directive interventions, things like paradoxical directives, or prescribing the symptom, so encouraging defiance to highlight its futility. All right, we want to disrupt the patterns, but the risk reinforcing the patient's defiance doesn't address structural issues. And then D, contextual therapy. What are we looking for here? Remember, this emphasizes relational fairness and loyalty. So encouraging the patient to express frustrations may validate their feelings, but it doesn't address the structural hierarchy issues. All right, so that is our review for structural family therapy. Good job. Let's go ahead and jump into that final question. I don't think I ever advanced the slide. So if you're watching videos here, I do apologize. Here is your slide for the family structures therapy. So if you need to take a minute to freeze it and read it, you can, or go ahead and move on. And we'll look at our final question here. Okay, so let's wrap up this family therapy series with the fifth and final. The question reads, a 50-year-old female with a history of alcohol use disorder presents to your clinic with her husband and adult daughter seeking to help for ongoing family arguments about her drinking. The family reports a pattern where the daughter confronts the patient about her alcohol use, and then the patient becomes defensive, and then the husband withdraws, refusing to engage. The patient insists, I don't have a problem, despite evidence of heavy drinking. And the family appears stuck in the cycle of confrontation and avoidance. Now, remember, if we were to go and look at the trans-theoretical model here, because mom is saying, I don't have a problem, despite the evidence, she would be in pre-contemplation, correct? All right, so as a PMHNP, you consider a family therapy approach that uses directive, often paradoxical interventions to disrupt maladaptive patterns and shift family dynamics. Which of the following best identifies the family therapy approach for this resistant family? Are we dealing with family systems therapy? B, structural family therapy? C, strategic family therapy? Or D, contextual family therapy? Those key words in the last two sentences are what are going to give it away. And by this point, I hope that you've got it solidified. Okay, the correct answer here is going to be clearly strategic family therapy. So, again, textbook example of a family locked in a repetitive, unproductive cycle that fuels conflict and resistance, particularly around a sensitive issue like alcohol use disorder. So, as PMHNPs, we need to choose a therapy that can break through the stalemate and spark change. So let's unpack this. Why? Why is this here? So, understanding this presentation, we have a 50-year-old with AUD, husband and daughter recognize there's a problem. The family starts to argue about it, and mom continues to say there's nothing wrong. Okay, so the family is stuck in a cycle of confrontation and avoidance, unable to move towards addressing the AUD and then resolving their conflict. So the patient's denial and the family's resistance to change suggests a rigid dynamic where each member's role, confronter, defender, and avoider, reinforces the problem. So her AUD, this is characterized by persistent drinking despite negative consequences, is both a driver and a symptom of the family dysfunction. We recognize that breaking that cycle requires a therapy that uses directive, sometimes paradoxical interventions to disrupt patterns and therefore fix the problem. So, in strategic family therapy, this is developed by Jay Haley, Milton Erickson, and others, focuses on disrupting maladaptive family patterns through directive interventions. Problem maintaining cycles. So families get stuck in repetitive interaction patterns, things like confrontation, defense, and then withdrawal that really perpetrate the problem. Then we have directive interventions where the therapist assigns a specific task to alter these patterns, such as changing roles or behaviors. Then we have a dangerous one, or could be dangerous, or it could be super powerful, paradoxical interventions. And you only use this one if you're 100% sure it's the right one to use. This is because this tasks that seem counterintuitive, like asking a family member to stop trying to fix the problem, and then this can shift dynamics by highlighting the futility of current behaviors and promoting new responses. So, in a nutshell, I know that was kind of wordy, but this is basically just saying reverse psychology, telling them to do something, expecting them to do the opposite. And that's why paradoxical interventions are tricky, but can be super helpful, especially in medication noncompliance. So in this family, the cycle, the daughter's confrontation, the parents' defensiveness, and then the husband's withdrawal, it keeps the family stuck, reinforcing the patient's denial and therefore escalating the problem with arguments. So strategic family therapy aims to disrupt the cycle with targeted intervention, creating a space for new interventions and new interactions that could lead to addressing, hopefully, in the end, the mother's AUD. All right. So I want to stay on this one for just a little bit longer because it's really important to understand why C is the correct answer here. And it's just because we got to give them something to do. They're just stuck in this circle, in this cycle, and unless we put in a very clear intervention from you as the provider, we're never gonna get rid of that cycle. All right, so let's talk about why the others are wrong. And again, by this point in time, you have heard it 5 separate times, so it should be sticking. Family systems therapy, we're looking at multi-generational patterns and triangulation. We do not see that here. And we're really, if we were to use this one, we could probably figure out how to use it, but we wouldn't be able to address immediate resistance and entrenched cycles. That would not be covered by family systems. And then structural family therapy. Remember, we're dealing with boundaries and subsystems. We do have some boundary issues here, and potentially we could even argue subsystems. But if we used structural, we would not look at the actual resistance and also the denial that's happening with mom. And then finally, contextual therapy. What does it have? Right, fairness and loyalty. So, if we encourage the family to acknowledge each other's concerns, that could validate feelings for sure. But it does not address the rigid interaction pattern that these three are having, which leads to confrontation, defense, and withdrawal. So, this particular approach, the contextual, it misses the directive cycle disrupting focus that we get with strategic family therapy. All right, you did it. You got to the very end here. That was an awesome dive into how strategic family therapy makes us shake up the family dynamics and then be able to help them um, figure out how to communicate better and stop the dysfunctional patterns that are occurring. Okay, um, so we've covered a lot today, from the systemic patterns to structural boundaries, contextual fairness, and strategic interventions, all to prep you for that PMHNP certification exam. So let's go ahead and wrap up with a look at what happens next in our live sessions, and finally, some words of encouragement to inspire you. All right, so we've tackled those five questions on family therapies. We dove into each one of them: the family systems therapy, the contextual, the structural, and the strategic family. And before we sign off with this free excerpt from the Clarity Education System's weekly live session, I just want to talk about what happens Wednesday nights at our gatherings at 7 p.m. Mountain Time. So after we work through the practice questions like we just did, we shift to a time that goes into an open forum where students are allowed to ask whatever they want. This is a space where currently enrolled students bring questions to the table, right? Are you struggling with your semester? Do you need clarity on something from the review program? Were you confused by material found in your studies? Or was there a particular practice question that you completed and just didn't understand? Or maybe you just want to talk about anything. This is a time to talk about test anxiety, career goals, you name it, it's open. So this forum is all about creating a supportive community to help you succeed. And it's accessible via a live link on the PMHNP student portal for enrolled students. So just log in, click the link on Wednesday night, and you'll be able to join the conversation. So if you're not yet enrolled but loved this session and other sessions like it, go ahead and head over to pmhnptesting.com to learn more about how we here at Clarity Education can support your exam prep journey. Now, as we close, I want to leave you with a couple of quotes that inspire me, and I hope they'll lift you up as you push towards your certification exam and passing it and getting it over with. All right, so first up, never regret anything that made you smile. And this is by Mark Twain. So this gem reminds us that we have to cherish the moments of joy, no matter how small, especially in the grind of grad school. Think about the times you smiled during this journey. Maybe it was nailing a tough practice question, or laughing with a study group, or feeling that spark when a family therapy concept clicked. Those moments are what fuel your resilience. Don't regret the late nights or tough days. They're part of the path that's shaping you into an incredible PMHNP. So we see research on positive psychology, and it shows that savoring these positive experiences boosts mental well-being, and probably most importantly for us right now, boosts academic perseverance, helping you to stay strong for the exam. So hold on to what makes you smile. It's a sign you're growing, even when it's hard. And finally, here, in the middle of every difficulty lies opportunity. Einstein's wisdom is a game changer for facing challenges. Preparing for the PMHNP exam, it can feel like a mountain of difficulty, complex cases, endless material, and the pressure to perform. But within those struggles lie opportunities to grow, learn, and shine. Every question you wrestle with, every concept you master is a chance to become a more confident, competent clinician. Maybe a tough family therapy case teaches you to think systematically, or a missed question reveals a gap that you can close. Now, studies on growth mindset show that viewing challenges as opportunities instead of failures increases motivation and success in high-stakes settings like licensure exams. So, embrace the difficulties. They're paving the way for your future as a PMHNP who transforms lives. All right, for our enrolled students, we'll see you Wednesday night at 7 p.m. Mountain Time for more practice questions and the open forum. Go ahead and bring those questions to the PMHNP student portal, and let's keep the learning going. If you're not yet a part of Clarity, check out PMHNPtesting.com to join our community. Remember to keep smiling, seize those opportunities, and know that you're on the path to greatness. You've got this. Until next time, bye-bye.